The CDS system has syndromic surveillance properties that has really brought some value to our healthcare safety net system. One of the attributes of the system is that it provides 24-hour turnaround of inpatient and ER diagnoses on a 24-hour turnaround. This system has great advantages for us because it allows those nurses and our clinical professionals to work on discharge planning for those patients, so those patients aren't staying in the hospital any longer than they need to be.
But what's really powerful about this is that it allows us to be proactive in contacting that patient. With this system, we're able to look at the patient, call them and ask them how they're feeling, ask them if perhaps they need to be seen sooner than the emergency room physician had requested, or perhaps they don't need to be seen as soon as the emergency room physician requested. And that allows us again to use those slots for walk-in patients that day. But the patient is contacted by a provider, and that is a very powerful tool for us. We are able to manage our patients in a way that we did not in the past, and we're able to keep them out of the hospital, out of the emergency room, and decrease the number of unnecessary visits to our clinic.
With ER Connect, we have immediate access to where they've been recently, their medications, and their diagnoses. And it's just amazing that this would come out of an indigent care program as opposed to one of the large insurance companies or from Medicare, but it did. And it has been extremely helpful to ER doctors in Orange County. We've seen a significant decrease in ER visits.
Our program works with over 6,000 providers within the county, and to them, SafetyNetConnect has satisfied the meaningful use criteria. It's given them critical patient information at the point of service, so they're able to provide better care to our patient population. It's improved coordination of care, it's decreased the duplication of services throughout our system, it's allowed ER physicians to better communicate to medical home providers, it's allowed our medical home providers to better communicate with our utilization management nurses.
There's no question that technology is valuable in managing patients with multiple comorbidities. We have limited resources, and in order to effect adequate continuity of care, I think it's critical that we have a way of monitoring the usage of our resources, and that we can therefore determine when and if we're using things appropriately, but at the same time utilizing evidence-based medicine and really providing quality care.
SafetyNetConnect has allowed us to improve the overall SafetyNet healthcare system within the county. From a cost savings perspective, it's reduced duplication of services, it's redirected patients to lower levels of care and more appropriate levels of care, and basically has provided actionable data to our medical home providers, which they previously didn't have.